Dr. Lee here with Austin Loatman, and he's now 1 month out from Translabyrinthine acoustic neuroma surgery for a large tumor that was compressing his brainstem, and we got the whole tumor out, and his face is doing great, his balance is great, the vestibular therapist already discharged him, but he had a delayed Bell's palsy, and why don't you explain that experience?
Yep. So yeah, right after surgery, I had full facial function. I looked at my wife, gave her a big smile. I was very happy. Around day 12, I was eating dinner, and I noticed the left side of my face was getting a little bit weaker. And I could feel it, start to get more and more weaker. So, between day 12 and day 14, I really felt my face start to deteriorate in the weakness. And by day 14, I was about probably like halfway to 2/3 of the way paralyzed, left side of my face. So I went on steroids after that, and it stabilized around day 14. And but now it's starting to improve quite a bit in the last week or so. Every single day, it gets a little bit better.
Yeah, Bell's palsy is pretty common, and just a lot of people get it, and almost everybody improves. And we usually attribute it to a virus. We don't know why surgery can actually sometimes cause this. It's pretty common. I don't know. I would say 1 in 50 to have a delayed Bell's palsy, and we haven't talked about it in this channel, so I thought I would interview someone with that. But it's always reassuring because delayed, 12 days later, I know it's not a surgical complication. Mm-hmm. From surgery, we worry that it's if you're going to recover, it takes a long time, and yours is already recovering. You're now how many days out?
Yep, I'm about a month and 2 days. So every single day it gets a little bit better, and it's about almost probably 90% better at this point. So every day it's a little bit better. So I'm feeling good. Yeah.
And then I just wanted to review you, like most of my patients, travel all over the Northeast trying to figure out who to have surgery with, and just want to get your opinions and thoughts.
Yeah, so I found out I had this large acoustic neuroma back in December 2024, and my goal was to give myself the best chances. I wanted to go to the best institution, find the best doctor, and I was between Penn and NYU, but what I saw with Dr. Lee just made me think this is where I wanted to be. I read his article in 2019 about how he's done over 1,000 acoustic neuroma surgeries, or whatever the number was. It was a very, very high number, and it's such a rare condition that I wanted to have a surgeon that does this surgery in high volume. I thought that was really important, and I know Dr. Lee and Dr. Bigelow do these in high volume. So I was really, really confident going with Penn. And, my stay at the hospital as well was amazing. I had the surgery over at the University of Penn, and it felt like a resort to me, honestly. I had a big TV at my feet watching March Madness basketball after surgery. It was wonderful. I mean, everyone there was, I felt like it was elite care. I felt like the nurses were elite there, the doctors, your residents, everyone was elite. So I was just so pleased and so happy choosing Penn, Dr. Lee, and Dr. Bigelow.
Thank you. That's good to hear. I would say that volume is very important, and I'm glad you did your research. I have to make sure I clarify, I've not done 1,000 acoustic neuroma surgeries, but I've definitely done about 1500 surgeries in the CP angle.
Yeah,
so
that was
but those numbers are climbing, and some weeks we do 2, 3. Virtually every week we're doing one of these, and so I'm glad you did your research. One other thing which is interesting about you, which is a swallowing issue you had before surgery.
Yeah. So before surgery, I had a horrible chronic gagging problem. Every little thing would trigger my gagging. I would walk outside, and the morning air would hit my throat. I would gag. I would drink coffee, get the slightest little, burp or something, and it would cause me to gag. But since my surgery, it is completely gone. It's been honestly life-changing, not gagging 30 plus times a day. So I am so happy with that result of surgery.
Yeah, now that's not something we normally talk about or even think about, but the larger the acoustic neuroma, the more it can press on multiple cranial nerves. So another common one is you get facial pain pushing on the trigeminal nerve, but I think it's very plausible that when the tumors get big and pushes on your lower cranial nerves, it can affect your swallowing. And in fact, that is a potential complication of surgery too, is to affect your swallowing. So I'm glad that that's better. And I'm looking forward to, we still have to follow. We're going to get 6-month MRI just to watch. If that looks clean, we'll get a 2-year MRI. If that looks clean, we'll do a 5-year, and then you're done.
Awesome.
So we'll see. But what are you most looking forward to going back to?
Definitely running and basketball. I run almost every single day. I play basketball 2 or 3 times a week with friends. So I'm really excited to get back active.
Excellent. Yeah. All right. Yeah. No, there should be no restrictions for that.
Oh, wonderful. That's amazing. Yeah.
All right. Very good.
Thank you so much.
Okay.